Hello, welcome to Next Fellow. I am Dr. Rajita, Faculty of Anatomy. Today we are going to discuss about the venous drainage of heart. So, venous drainage of heart is mainly by three groups of veins which forms the coronary sinus, which is the major venous drainage called as tributaries of coronary sinus, anterior cardiac veins and venae caudes minimi. So, coronary sinus is here. This is the coronary sinus, which is well seen on the posterior view between the posterior and the inferior surface of heart, and directly from the wall of the ventricle we can see some blood draining into the right atrium. These are called anterior cardiac veins, and venae caudes minimi are the small cardiac veins. They are present in the walls of all four chambers, which directly drain into the blood present in the chamber. And venae caudes minimi are more prominent, more seen on the right side than on left side of the heart, left chambers of the heart. So talking first about anterior cardiac veins. Anterior cardiac veins drains the infundibulum of the right ventricle and ends directly into the right atrium. So it doesn't have any communication with the coronary sinus. They are the separate veins. So these are the anterior cardiac veins which are draining the infundibulum of the right ventricle directly into the right atrium. So these are the anterior cardiac veins. Venae caudes minimi open directly into all the chambers of the heart, and they are numerous on the right side than on the left side. They are small minute veins which are present within the wall of the heart. Let's talk about the major part, that is the coronary sinus. Coronary sinus present on the left posterior coronary sulcus. Okay, it runs along with the left coronary artery in the left posterior coronary sulcus. So this is the coronary sinus. This blue band is the coronary sinus. We can see it is opening onto the right atrium. This is the right atrium. This is the inferior vena cava, and we can see here is the superior vena cava. So the coronary sinus, we can see here, it just opens near the inferior vena cava. So let's appreciate its opening here. This is the coronary sinus inside the right atrium, just near the opening of inferior vena cava. And we can see a valve guarding the coronary sinus, which is called as Thebesian valve. So that is about the opening of the coronary sinus. Let's see the tributaries of coronary sinus. Coronary sinus, the main tributaries are the right marginal vein. So this is the right marginal vein which continues as small cardiac vein which opens into the coronary sinus. So this is the coronary sinus on the posterior side of the heart, and this opening is the opening of coronary sinus into the right atrium of the heart. And from the other side we can see this is the great cardiac vein which winds round the left border of the heart to opens into coronary sinus. And this is the ventricular veins, left ventricular vein, and this oblique vein is the oblique vein of left atrium. So here is the left atrium on the posterior side. So oblique vein of left atrium, and the one which is running in the posterior interventricular groove is called as middle cardiac vein. So this is the middle cardiac vein draining into the coronary sinus, and these are anterior cardiac veins which doesn't have any connection with the coronary sinus. So this is the posterior view of coronary sinus. You can see here, this is the coronary sinus. This is the middle cardiac vein running in the posterior interventricular groove. This is the left ventricular veins, and we can see the great cardiac vein winding round the left border of the heart and continuing into the coronary sinus. This is the oblique vein of left atrium. So this is the left atrium. This is the oblique vein of left atrium. So great cardiac vein is here. This is the great cardiac vein. This is middle cardiac vein. This is the small cardiac vein which is the continuation of right marginal vein, and posterior vein of left ventricle. This is the posterior vein of left ventricle. Oblique vein of left atrium. Oblique vein of left atrium is otherwise called as vein of Marshall. So let's do some schematic image to understand. So this is the posterior view of heart. So this is the right atrium, this is the right atrium, this is the left atrium. Here is the superior vena cava, inferior vena cava and superior vena cava. So this one is the interatrial septum. This is the right atrium and this is the left atrium. And these four are pulmonary veins. You can see the pulmonary veins here. This is the superior vena cava. This is the inferior vena cava. This is the superior vena cava and this one is the inferior vena cava. So the artery here which opens into this is the coronary sinus. This is our coronary sinus. So this is the great cardiac vein, which is from the anterior side winding and opening. And this is the right ventricle. Here is the left ventricle. So this is the right ventricle, this is the left ventricle. So here is the schematic image of the posterior and inferior surface of heart to understand. This is the posterior interventricular groove. So within the groove we have got posterior interventricular artery. Along with the posterior interventricular artery, middle cardiac vein is present. So middle cardiac vein which is opening into the coronary sinus. So that's how we can remember the tributaries of coronary sinus. Great cardiac vein, this is great cardiac vein, and this one is the small cardiac vein which is the continuation of right marginal vein, and this is the left ventricular veins, and also along with the left ventricular veins there is one more vein from the left atrium called as oblique vein of left atrium, and this one is the middle cardiac vein. So next we shall talk about what opens into the coronary sinus: middle cardiac vein or small cardiac vein, anterior cardiac vein and great cardiac vein. So we know the middle cardiac vein opens it, small cardiac vein opens it, and great cardiac. What doesn't open is the anterior cardiac vein doesn't open it. So anterior cardiac vein open into the anterior wall of right atrium directly. Doesn't have any communication with the coronary sinus at all. So most of the veins of the heart drains into the coronary sinus except anterior cardiac veins and vena cordis minimi or small cardiac veins. The smallest cardiac veins drain into the all four chambers of the heart. So that is about 2 MCQs of venous drainage of heart. Thank you.